Hi and welcome. I am trying to learn medicine. Today, sickle cell anemia and megaloblastic anemia. And after we've done that, we're going to do a bit standing yoga. And if you participate in the standing yoga, then it's very honest. And we're talking about the blood system and internal anatomy. And this is no medical advice, we're just reading about. Sickle cell anemia, an inherited condition found almost exclusively in black people with black skin. Symptoms start in childhood. Both sexes are affected equally. Okay, sickle cell anemia. That is a form of anemia. So anemia is a reduction in the quantity of the hemoglobins which are carrying the oxygen in the blood. And sickle cell anemia, that is something which almost exclusively people with black skin have. And the symptoms start in childhood. Symptoms: slight yellow discoloration of the skin and eyeballs. So there's a slightly yellow discoloration of the skin and the eyeballs. Feverishness, weakness, and anemia, especially after strenuous physical exercise. What is it? It's not the anemia. By sickle cell anemia happens after physical exercise. I haven't thought about anemia that way. But people can have it, but the real anemia happens when the hemoglobins are necessary, are needed. Feverishness, weakness, and anemia, especially after strenuous physical exercise. Okay, anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. How fast does anemia not happen? I ask it here with iron deficiency anemia. There was written here, the condition should be cured within 6 months of treatment. Now this with the breathing sounds again like something happening within seconds or minutes. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. This is sickle cell anemia, it is completely different. Blood clots may occur anywhere in the body. Okay, blood clots. Okay. Duration. The condition is chronic, persisting throughout a patient's life. Okay, persist, causes an abnormal hemoglobin present in what? Anemia, a reduction in the quantity of oxygen-carrying hemoglobin in the blood. So, sickle cell anemia, an abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood which carries oxygen from the lungs to the tissues. Okay. If, because of exertion or respiratory infection, the amount of oxygen in the blood is reduced, the abnormal hemoglobin causes the blood cells to deform into a sickle shape. Okay, the hemoglobin is there, but it isn't working properly. So, if because of exertion or heavy breathing, respiratory infection of a flu or whatever, common cold, of a respiratory infection, the amount of oxygen in the blood is reduced. Okay, people have less oxygen because they're doing sport or they're having an infection. And when the abnormal hemoglobin causes the blood cells to deform into a sickle shape. Okay, there's something wrong with the hemoglobin. This is about sickle cell anemia, but has nothing to do with iron deficiency. Anemia, we have to understand it. Anemia is a condition in which the quantity of oxygen carrying hemoglobin is reduced. It has nothing to do with iron in the first place. Just the hemoglobin is in its quantity reduced. That can be because the hemoglobin is not produced because iron is missing. That can be because vitamin B12 by percutaneous anemia is missing to produce the hemoglobin. It can be because the hemoglobins are abnormally. And if there is too less oxygen, they are deforming and getting sickle shaped. So the sickle is used to cut grass. And getting sickle shaped instead of more flat or round or something. And they're deformed, they're changing the form. So it has nothing to do with iron. It is just too little hemoglobin. It can be by iron deficiency because of too little iron to produce it. It can be by perinicius because the vitamin B12 is missing, because the stomach isn't taking it from the food. It's not eaten, the stomach isn't taking it. And sickle cell they are not properly. They are deforming into sickles. These cells are then destroyed by the body's immune system, causing anemia. And they are deforming it, and then the body says you are sickle, and we don't want you, and then they destroy the sickle anemia, the sickle hemoglobin. And now we're told that hemoglobin. Complications. Ulcers and local infections may occur in bones, kidneys, and other organs. Okay, people can get ulcers and also local infections in the bones, in the kidneys, and other organs. Okay, ulcers and local infections in different places at the organs, bones, and kidneys. Treatment in the home, none. When to consult the doctor? If any symptoms of the illness are noticed. Symptoms were slight yellow discoloration of the skin and eyeballs, feverish weakness and anemia, especially after strenuous physical exercise. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Blood clots may occur anywhere in the body. Okay. So basically the two main symptoms were feverish weakness, anemia after a sport or heavy breathing, and also slight discoloration of the skin and the eyeballs into yellow. What the doctor might do: take blood tests to find out whether abnormalities are present. Okay, we take blood tests, arrange for the patient to have regular blood transfusions if sickle cell anemia is diagnosed. This is the only form of treatment available. This book's from the 80s, so maybe there was something done. But they are saying now here, blood transfusions, people getting new blood. And this is the only form of treatment available. Prevention. There is no way of preventing the disease, but avoiding strenuous physical activity may reduce the risk of severe crisis occurring. So basically the people are unable to do sport. And they get a problem if they have respiratory infections. In that case, I actually want to have a real case. Interview. Instead of just a book, theoretically. Outlook. Complications arising from the anemia may result in death at any age, but many sufferers survive beyond middle age. That means if it gets really worse, the people actually die. Megaloblastic anemia. A form of anemia similar to pernicious anemia. It develops if a diet is deficient in folic acid, which is present in liver and vegetables. Okay, the people don't eat enough of some type of folic acid since they are in liver and in some vegetables. Pregnant women and the elderly are particularly vulnerable. You would like to know why? Because this is about food. The other thing was iron deficiency anemia. That can be because during pregnancy or heavy periods and any blood loss at all. Now why no megaloblastic anemia, where it is not enough eaten of this folic acid? Why is that now with pregnancy? And also with people who have aged longer. The symptoms are similar to those of pernicious anemia. The symptoms were: the tongue is sore, smooth and inflamed in places, persistent diarrhea, tingling in the fingers and toes, in the case of the facial skin and yellow tint. That means some people can have these problems when they're pregnant because of megaloblastic anemia, because they're not eating enough folic acids. Let's look what we write, how it can be prevented. The symptoms are similar to those of pernicious anemia. The treatment is to give folic acid tablets. Is it also possible to eat then liver or vegetables right there? If the diet is deficient, we're not saying there's a problem with absorption as it was here by pernicious anemia, failure of the stomach to produce an enzyme, the intrinsic factor which is needed for the absorption of vitamin B12 from food. So we cannot get it from the food because we're not producing an enzyme necessary to get it from the food. And also the treatment. If the diagnosis is confirmed, prescribe a course of vitamin B12 injections. So here's saying that if the people are not producing the enzyme to get with it to absorb with it the vitamin B12 out of the food, they are getting the vitamin B12, not the enzyme. I think this is also at least something interesting to point out, and that is true. So megaloblastic, there is enough folic acid probably eaten, but it's not enough eaten. And it's taken out, but it's probably not enough eaten. And we're saying again, Folic acid absorber is my question. Is it also possible to eat more vegetables? This is why such tablets are given often as a preventive to those who may be at risk. And who would be at risk? Elderly and pregnant women? Or anything else? The problem is deficiency in folic acid. If a diet is deficient in folic acid. Okay, I think this is a bit shortened down here to megaloblastic anemia. Whatever, it is still a problem, but there is not enough folic acid eaten. And this is in particular been a problem, or it happens particularly by people who are pregnant or who are already a lot aged. And that happens. Okay, that was megaloblastic. Is it megaloblastic? Megaloblastic and sickle cell anemia. If you were here for anemia, you can go directly to the next part of medicine. So if you were here for medicine, this was no medical advice. Again, this was no medical advice. We just read about it and speculated about it. If you were here for medicine, you can go directly to the next part of medicine. We will do now the stand yoga. If you stay and participate in the short yoga, that's where the arms. So we're doing a bit power yoga. Yeah, standing. If you participate, that's where the arms. The feet are standing together, we the arms. On and down. In and up. On and down. In and up. Out to the side. Up. Out to the other side. Up. Inch space between the feet and up to the side. In and up. Out and down. In and up. Out to the side. In and up. In and out and down. In and up. Arms down, we're leaning onto the knees. Breathe in. And out, make a head with the back. In into the middle. Out around back. In into the middle. Out around back. In into the middle. Out around back. Into the middle. Out, come around back up. Make it top, backward, shoulder. Breathe in with the arms up. Out to the side. In and up. Out to the other side. In and up. Out all the sides down. Breathe in, come halfway up. Come high up. And out and come up again. Breathe in. And out again, down. Breathe in, come halfway down. Up. High up. And out and up. Come out to the toes. And breathe out and sink slowly down. This can go a bit on the knees. And come out. Out and down. Again up. Out the hands down, feet together, lid down. Breathe in with the right leg. Breathe out, stretch the left leg. Breathe in, change. Out and stretch the right leg. In and change. Out, stretch the left leg. In and change. Out, stretch the right leg. In into the middle. Out and down. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in the hand down. Out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. In and down. Down and down. Make a hand with space between the feet. Shift the weight to the heels. Breathe in and get up. And out and up. In and down. Out and up. Take out on the elbows and gently rock from side to side. Down with hands, feet together. Breathe and come halfway up with a straight back. Out and down. In halfway up. Out and down. Breathe in. And out and come. And the toes are pointing to the outside. Tall up, and then space between the heels. Breathe in. Out, chin down onto the chest, and roll slowly down, one vertebra at a time, and slowly down to the right. Elbows against the inside of the knees, breathe in straight. And out, tuck the pelvis in and come with the crown of the head first up. And it's down. Have the feet sitting together, breathe in with the arms up. Over across the arms, breathe in, reach high. And out, reach in front of the back. In and up. Out across the arm, in and around, breathe in, reach high. Out, reach in front of the back. In and up. Out, lean back with long arms. In and up. Out and back. In and up. Out, hands down. In and up. Out and down. In and up. Let my hands together and bring them down to heart center. It was a fast and short and steady yoga. I thank you very much and next time.